If we were to jump in a time machine right now and travel back to, say, 1550 BCE in ancient Egypt, you'd find healers meticulously consulting this medical text known as the Ebers Papyrus.
Oh, wow. Going way back.
Right. And if you happen to have a stomach ache after a heavy meal along the Nile, they'd basically hand you a dose of powdered chalk.
Which sounds awful, honestly.
It really does. But then fast forward a few centuries to the 1st century CE, and the Roman naturalist Pliny the Elder would have you grinding up ocean coral to cure a sour stomach.
Which is an incredible starting point, because ground coral and chalk are essentially just naturally occurring calcium carbonate.
Wait, really?
Yeah. So, in other words, Pliny the Elder was basically prescribing ancient Tums to Roman citizens.
That completely blew my mind when I read it. And I mean, that is exactly the mission of our deep dive today. We are looking at fast acid neutralizers.
Which are so incredibly common.
Exactly. Those seemingly mundane, over-the-counter antacids that are almost certainly sitting in your medicine cabinet right now.
Yeah, everybody has them.
We're going to track how these ancient remedies evolved, how they actually work on a chemical level, and why treating them like harmless little breath mints after a spicy dinner is a massive misunderstanding of what they actually do to your body.
It's just a vital topic for us to explore because, heartburn is nearly universal.
Right.
Whether it's driven by our modern, highly processed diets, chronic stress, or just, indulging in a heavy meal, almost everyone experiences that uncomfortable burning sensation at some point.
Oh, for sure.
And because these pills are so accessible, you can buy them at any gas station. It's easy for you to assume they just don't carry any real pharmacological weight.
It's just candy, basically.
Right. But these simple over-the-counter drugs are causing very real, very complex chemical reactions inside your digestive tract.
Okay, let's unpack this. Because the very first thing we need to understand is what actually makes a chewable antacid different from, say, a modern prescription medication you might get from a doctor.
Yeah, that's a crucial distinction.
Because if I go to the gastroenterologist for chronic heartburn, they're probably going to give me something like a PPI, a proton pump inhibitor, or an H2 blocker.
Well, the foundational difference comes down to this battle between production versus destruction.
Okay.
Drugs like PPIs or H2 blockers, they actually go into the physiological machinery of your stomach and reduce the amount of acid your body is capable of manufacturing.
So they turn off the factory.
Exactly. They turn down the dial on the acid factories themselves. Antacids, on the other hand, do absolutely nothing to stop acid production.
Wait, nothing at all?
Nothing. They don't communicate with your cells. They don't alter your stomach's manufacturing process. They just neutralize the acid that has already been pumped out and is, sitting there in the stomach cavity.
Okay, so if they aren't stopping the acid from being made in the first place, we really need to understand exactly what happens when that chalky tablet actually hits the pool of stomach acid.
Right.
What is the physical reaction taking place?
Let's look at it from first principles. Your stomach lining is packed with these specialized structures called parietal cells, and their job is to secrete hydrochloric acid, or HCl.
Which is some serious acid.
Oh, yeah. This brings your stomach's resting pH down to a highly acidic 1.5 to 2. Now, antacids are what chemists call weak bases. Usually they are hydroxides, carbonates, or bicarbonates.
Okay, got it.
When you drop one of those weak bases into a highly acidic pool of hydrochloric acid, a very swift, very straightforward acid-base chemical reaction occurs.
Just simple chemistry?
Exactly. They neutralize each other, and in the process, they create water and a salt.
It sounds so peaceful when you put it like that, just water and salt. But I'm guessing it's not always a perfectly clean process, right?
Not always, no.
Because if I mix certain bases with acids, like that classic baking soda and vinegar volcano from elementary school, I get a lot of bubbling.
You've hit on a crucial detail there. This is where the specific ingredients in your medicine cabinet really matter. If you are taking a carbonate or bicarbonate-based antacid, like sodium bicarbonate or the calcium carbonate in those ancient Roman remedies, that chemical reaction doesn't just make salt and water.
What else does it make?
It also releases carbon dioxide.
Ah, gas. So that explains the immediate belching and, the bloating you get after chewing a couple of those tablets.
Precisely. The acid is neutralizing, but you are rapidly expanding your stomach with CO2 gas.
I mean, a burp seems pretty harmless, though.
Yeah, usually, yes. But in rare, extreme cases where someone rapidly consumes massive quantities of these carbonate antacids, the gas accumulation can cause sudden gastric distension.
Whoa.
Yeah, it can actually expand the stomach fast enough to risk perforating or tearing a stomach wall that's already diseased or weakened by severe ulcers.
That is terrifying. Okay, so we're rapidly changing the pH of the stomach, and we are creating gas.
Yeah.
Now, the pharmacological definition for a successful antacid brings up this very specific metric called the acid neutralizing capacity.
Yeah, the ANC.
Right, and it defines success as pushing the stomach's pH up to 3.5 for at least 10 minutes. Why 3.5? That feels like an incredibly specific, random number.
What's fascinating here is that 3.5 isn't just some random number scientists pulled out of thin air. It is an essential biochemical threshold for survival.
Survival, really?
Yeah. Your stomach uses a powerful enzyme called pepsin to digest the proteins in the food you eat. But pepsin is tricky. It is auto-activated by high acidity.
So it needs the acid to work.
Exactly. It only turns on and works best when the pH is between 1.5 and 3.5. If the stomach's pH goes above 4, pepsin becomes irreversibly denatured.
Meaning it breaks down.
Right, its physical structure breaks down and it completely stops working.
Wait, let me make sure I'm following this. The stomach lining and the esophagus are themselves made of proteins.
Yes, they are.
So if I have an ulcer or severe acid reflux, pepsin isn't just digesting my dinner. It's the thing that's literally eating away at my own internal tissue.
Exactly. The acid causes the burn, but the pepsin is what causes the deep tissue damage.
Oh, wow.
So an antacid doesn't just stop the burn by slightly diluting the acid. By pushing the pH past that 3.5 or 4 mark, it literally shuts down the flesh-eating enzyme that is actively digesting your esophagus.
So taking an antacid is basically like throwing an armful of heavy towels onto a massive ongoing spill to mop it up. It handles the immediate dangerous mess on the floor.
That's a great way to put it.
Whereas drugs like PPIs or H2 blockers are like, I don't know, going under the sink to turn off the faucet entirely.
That is a perfect analogy. You need the towels right now because the floor is getting ruined, but eventually you have to turn off the water.
Right, right.
This also clears up a huge misunderstanding people have about why antacids act so incredibly fast but wear off so quickly.
Yeah, why is that?
Well, they aren't obsolete just because we have better prescription drugs now. They just serve a different purpose. An antacid works in minutes to put out the fire and shut down pepsin, but the relief only lasts maybe 20 to 60 minutes.
Because the faucet is still on.
Exactly. The stomach is still pumping out new acid. A PPI might take 3 days to reach its full effect, but it keeps the faucet off long term.
Okay, so if all these over-the-counter pills are just doing the exact same mopping up chemical reaction, I can just grab whatever brand is cheapest at the pharmacy, right?
I wouldn't do that.
No. I mean, it's all just weak bases and acid. It shouldn't matter if it's chalk or a liquid gel.
I would strongly advise against treating them all the same. This is where we get into the element of surprise in pharmacology.
Okay, lay it on me.
The acid neutralizing part of the reaction, the mopping up, is identical, yes.
Mm-hmm.
But remember a few minutes ago when we said the reaction creates water and a salt.
Yeah.
That salt leaves behind a cation, a positively charged metal ion in your digestive tract.
Mm-hmm.
And that leftover cation dictates the entire side effect profile of the drug.
Oh, so we're talking about the metals, the magnesium, the calcium, the aluminum.
Exactly.
Let's walk through these because this really completely changed how I look at pharmacy shelves.
Let's start with magnesium hydroxide. When magnesium is left behind in the gut after the acid is neutralized, it has what we call an osmotic effect.
Meaning it acts like a sponge, like it's pulling water from the rest of your body into your intestines.
That's exactly it. The magnesium pulls fluid into the bowel, and the inevitable result of all that excess water accumulating in your lower digestive tract is
diarrhea.
Unfortunately, yes.
Which suddenly makes perfect sense as to why the famous liquid laxative is called milk of magnesia. It's literally the exact same chemical, just being used for its side effect instead of its primary acid neutralizing effect.
Precisely. It's a feature, not a bug, depending on what you need.
Mm.
Now let's look at the opposite side of the spectrum. Aluminum hydroxide.
Okay.
Aluminum does the exact opposite of magnesium. It significantly slows down gastrointestinal motility.
So it stops things from moving.
Right. It stops things from moving through the pipes, meaning it leads to severe constipation.
Hold on. If aluminum causes a massive traffic jam, and magnesium causes a flood, why don't pharmaceutical companies just smash them together into one pill so they cancel each other out?
It's funny you say that because that is the exact stroke of pharmaceutical genius that formulators came up with.
Wait, really?
Yeah. If you look closely at the active ingredients in combination liquid products like Malox or Malanta, they are specifically formulated with both magnesium hydroxide and aluminum hydroxide.
That is incredibly clever.
They literally exploit those opposing physiological side effects, so they neutralize each other, theoretically keeping your digestion perfectly normal while still raising the pH of the stomach.
Man, pharmacology is wild. But what about calcium carbonate? That's the
Yeah.
classic ingredient in Tums, the modern version of the ground coral we talked about earlier.
Yeah.
If I take that, what is the calcium doing?
Well, calcium carbonate can also cause constipation, but it has a much more deceptive quirk.
Oh,
Calcium directly stimulates specialized cells in your stomach called G cells. When stimulated, these G cells release a hormone called gastrin.
and what does gastrin do?
Its primary job is to tell your stomach to produce more acid.
Wait, why would it do that? Does the stomach mistake the calcium for food and think it needs to start digesting?
Essentially, yes. Calcium is a really potent trigger for acid secretion.
So that completely backfires.
Right, so you chew a calcium antacid, the base neutralizes the existing acid, the pepsin shuts down, and you feel great within 5 minutes.
Okay.
But meanwhile, that leftover calcium is ringing the alarm bell on the G cells. Once the drug wears off an hour later, that gastrin triggers what we call acid rebound,
Which is what?
a paradoxical, massive spike in brand new acid secretion.
So the very thing curing your heartburn at 7 p.m. can actually cause a significantly worse wave of heartburn at 8 p.m.
Exactly.
That is a wild biological loophole. What about sodium bicarbonate? That's basically just baking soda, right?
Yeah, and sodium bicarbonate is tricky because unlike the others, it doesn't just stay in the gut.
Where does it go?
It is fully and rapidly absorbed into your systemic circulation,
Yeah.
your bloodstream. This delivers a massive sodium load to your entire body. If you are a young, healthy person, your kidneys can probably handle it. But if you're an older patient with hypertension or heart failure,
That sounds like a recipe for disaster.
it is. Suddenly dumping a huge load of sodium into your system will cause you to retain water and spike your blood pressure, which is genuinely dangerous.
Which brings us to a really important turning point in this deep dive. I mean, a little diarrhea or constipation is one thing, but has there ever been a time when these supposedly harmless bases actually caused widespread danger?
Oh, absolutely.
Because it sounds like we're playing with some pretty fundamental body chemistry here.
To answer that, we really have to look at one of the darkest eras in gastroenterology.
Okay.
Today, we know antacids should only be used locally in the stomach for transient, short-term relief. You're just mopping up the skill.
Right.
But for a long time, the medical establishment viewed antacids as a systemic therapy. They actually wanted to permanently change the pH of the entire human body.
To set the stage for this, there are some amazing origin stories from the late 19th and early 20th centuries.
Oh yeah, lots of interesting history.
Like, you had Charles Henry Phillips inventing his milk of magnesia in the 1870s. And then in 1928, a St. Louis pharmacist named James Howe literally mixed calcium carbonate with sugar and peppermint oil just to cure his wife's chronic indigestion.
Which he eventually branded as Tums.
Exactly. But the medical establishment really went off the rails with something called the sippy diet, right?
Yes, the sippy diet is a massive cautionary tale.
What was it?
Well, in 1915, a prominent Chicago doctor named Bertram Welton Sippy created a strict regimen for treating stomach ulcers.
Okay.
His theory was that if you constantly, relentlessly buffered the stomach acid, the ulcer would finally have a chance to heal.
Makes sense on paper, I guess.
Right, so he prescribed hourly feedings of milk and heavy cream
Hourly.
every single hour. And he supplemented that with massive doses of powdered alkali, specifically sodium bicarbonate and calcium carbonate, around the clock, day and night.
Wait. So to cure a localized sore in the stomach, they tried to flood the patient with dairy and chalk to change the alkaline level of their blood.
That was the goal.
That's like trying to put out a small campfire in your backyard by opening a dam and flooding the entire town.
It was incredibly dangerous because of the biological mechanisms it triggered. It led to a condition that became known as milk alkali syndrome.
Milk alkali syndrome. Okay. What happened to these patients?
Patients who were consuming quarts of milk and huge amounts of alkali powders developed a lethal triad of symptoms.
Lethal.
Yeah. First, hypercalcemia, which is dangerously high levels of calcium in the blood. Second, metabolic alkalosis, meaning their blood became far too basic.
And what does that actually do to the body?
It destroys the kidneys.
Oh, man.
The high calcium causes the blood vessels in the kidneys to constrict, massively reducing their ability to filter toxins.
Right.
At the same time, because the blood is too alkaline, the kidneys lose their ability to excrete that excess calcium. It becomes a vicious compounding cycle, leading to severe renal insufficiency.
Meaning total kidney failure.
Exactly. Total kidney failure.
And this wasn't just a rare side effect for one or two people, right? This became the second or third leading cause of hospitalized hypercalcemia at the time. People were literally destroying their organs trying to cure a stomachache.
It was an absolute disaster.
Yeah.
The medical field eventually realized their error, completely abandoned the sippy diet, and recognized that antacids must be strictly local and temporary.
So they learned their lesson.
Well, for decades, milk alkali syndrome essentially vanished from hospitals. But if we connect this to the bigger picture of how people view over-the-counter drugs, the syndrome shockingly returned in the 1990s.
Wait, how does a disease caused by a 1915 milk and cream diet suddenly come back in the 1990s?
Because of self-medication and good intentions.
What do you mean?
Postmenopausal women, eager to prevent osteoporosis and bone density loss, began self-dosing massive amounts of over-the-counter calcium carbonate.
So basically eating handfuls of Tums every day.
Exactly. And crucially, they were often taking this alongside vitamin D supplements.
Oh, because vitamin D helps with bones too.
Right. But vitamin D drastically increases the intestine's ability to absorb calcium into the bloodstream. By combining the two, they accidentally recreated the exact chemical conditions of the sippy diet.
You've got to be kidding me.
Nope. The syndrome reemerged as a leading cause of hospital admissions for kidney failure all over again.
It's that dangerous assumption that, if one pill is good, 10 must be better, especially when you don't need a prescription.
Exactly.
And there's another historical tragedy from the 1970s and 80s involving aluminum, right?
Right. Chronic renal failure patients on dialysis were often given aluminum hydroxide antacids.
For heartburn.
No, not for heartburn. They used it to act as a sponge to bind excess phosphates in their blood.
Oh, I see.
But because their kidneys were already failing, they couldn't filter the aluminum out. The metal accumulated in their brains and bones.
That sounds horrific.
It led to a fatal neurological condition dubbed dialysis dementia, along with severe bone disease. It forced an entirely new protocol for dialysis practices worldwide just to eliminate aluminum exposure.
So we're seeing time and time again that changing your body's chemistry, even with something as simple as a basic metal ion like calcium or aluminum, has massive ripple effects.
They're huge effects.
But even if you aren't downing quarts of milk or taking huge handfuls of calcium for your bones, you might be unknowingly causing chaos in your system right now just by mixing a normal dose of antacids with your daily prescriptions.
Yes.
Which brings us to the hidden clashes of drug interactions.
This is perhaps the most practical, urgent takeaway for anyone listening. Antacids dramatically alter the gastric environment, and in doing so, they can completely sabotage other life-saving medications.
To set this up, I absolutely love the origin story of Alka-Seltzer from 1931.
It's a great story.
Maurice Trenier, who was the head chemist at Miles Laboratories, heard about a local newspaper editor in Indiana who miraculously survived the deadly 1928 flu outbreak. The editor claimed his secret to survival was a homemade mixture of aspirin and baking soda. So Trenier got to work and formulated an effervescent tablet combining sodium bicarbonate, citric acid, and aspirin.
It's a brilliant piece of pharmaceutical history, and it doubles as a perfect pharmacokinetics lesson.
How so?
When you drop an Alka-Seltzer in a glass of water, the bicarbonate and citric acid react to create that famous fizz.
Yeah.
But the real magic happens inside the stomach.
Okay.
That bicarbonate neutralizes the stomach acid, but it also chemically interacts with the aspirin. It converts some of the aspirin into a water-soluble sodium salt.
Meaning it changes the aspirin itself.
Yes. It literally changes the physical properties of the drug, which alters how fast your body absorbs it into the bloodstream.
So let's apply that logic to daily life. If I'm listening to this right now, I might be looking at the roll of antacids on my desk and wondering if I just ruined the medication I took an hour ago.
That's a very valid concern.
Say I'm taking a heavy-duty antibiotic for a sinus infection, and the antibiotic is just, upsetting my stomach. I might logically think I'll just take my antibiotic and my antacid at the exact same time to save a step and stop the nausea.
Right. Makes sense intuitively.
Am I basically neutralizing my own prescription?
You are. And this raises an incredibly important question about how molecules physically interact in the gut. The danger here is a process called chelation.
Chelation. Okay, let's break that down. What does that actually look like inside the stomach?
You'll sometimes see terms like divalent or trivalent occasions. Basically, we are talking about highly charged metal ions.
The calcium, the magnesium, the aluminum we talked about.
Exactly. In the stomach, these metals act like incredibly strong chemical magnets. If you take them at the same time as certain powerful antibiotics, like tetracyclines or fluoroquinolones, The metal ions will actually physically bind directly to the antibiotic molecules.
Wait, they attach to each other like a clump?
Yes, they form what chemists call an insoluble complex. It's a bulky, heavy chemical cluster. Because the antibiotic is now shackled to this heavy metal ion, your body's intestines are completely incapable of absorbing it through the intestinal wall.
Oh, because it's too big.
It's too big and chemically incompatible.
Ooh.
So the antibiotic never reaches your bloodstream. It just passes right through your digestive tract and out of your body.
It's like putting a heavy chemical boot on the antibiotics car tire. It can't go anywhere, it can't do its job, and it just gets dragged out of your system.
That's exactly what's happening.
How much of the medicine do you actually lose when this happens?
Studies show that taking an antacid with these antibiotics can drop the antibiotic's bioavailability, which is the amount that actually makes it into your blood to fight the infection, by anywhere from 50 to 90%.
A 90% drop.
Up to 90%, yes.
You could be taking your antibiotics religiously every single day to fight a severe infection, but if you're chasing them with the Tums because your stomach hurts, you might only be getting 10% of the medicine.
Which is terrifying.
You're basically taking a placebo at that point.
Exactly. It completely defeats the purpose of the prescription.
Yeah.
It's why standard medical advice mandates that you must separate antacids from other oral pills by at least 2 to 4 hours.
Just to give it time to absorb.
You have to give your prescription time to fully absorb into your bloodstream before you throw a bunch of heavy binding metals into the mix.
Wow. So, to summarize the journey we've been on today, we've seen that these ancient remedies, from Egyptian chalk to modern pharmacy tablets, are essentially rapid chemical mops.
Right.
They neutralize the existing acid pool, which raises the pH just enough to shut down the flesh-eating enzyme pepsin. But the medications they leave behind dictate this wild ride of side effects, from massive acid rebound and osmotic diarrhea to completely blocking your body's ability to absorb vital antibiotics.
And that perfectly encapsulates the modern division of labor in gastroenterology.
How so?
Antacids remain the absolute kings of immediate short-term breakthrough symptom relief. They put the fire out in minutes.
Right.
But PPIs and H2 blockers do the heavy lifting of actually preventing acid production over the long term, which takes days to establish. They are complementary tools in the medical toolkit, not competitors.
It really makes you look at that little plastic bottle of chewable tablets entirely differently.
It really should.
Which leaves us with one final thing to ponder as we wrap up this deep dive. We just learned that slightly changing the stomach's pH or introducing a simple metal ion like calcium or magnesium can completely shut down a prescription antibiotic's effectiveness by up to 90%.
Yeah.
So considering how many millions of people casually pop these fast-acting antacids after every single heavy meal or spicy dinner, what other unseen chemical reactions, what other absorptions or nutrient blockages are happening in our gut every single day just because we wanted to stop a little heartburn?
It's a highly complex, delicate ecosystem in there, and every time we introduce a rapid neutralizer, we are fundamentally changing the rules of the environment.
Something to think about next time you reach for the modern equivalent of Pliny the Elder's ground coral. Take a minute to read the label on those medicine cabinet bottles a little more closely, and maybe give your other medications a few hours of breathing room. Thanks for joining us on this deep dive.